Welcome to Workplace Psychology with Dr. Martha Greidick. I'm Dr. Martha Greidick. This podcast examines a wide variety of work-related issues through the lens of industrial and organizational psychology. And while many of the topics discussed here may be seen as intended for white-collar employees and their employers, in reality, the ideas presented here are applicable across organizations and industries. Additionally, many of the topics discussed here may be applicable outside of the workplace. I encourage you to examine what's presented here, apply what makes sense to you, and simply discard the rest. Burnout is a big deal. I've talked to you about burnout in the past. And one of the things that is important to remember about burnout is that it's not something that happens overnight. It's a process. Getting into that state of burnout, it's a process, and it tends to be a long one. It may vary from person to person, and how burnout looks, how it manifests will look a little bit different for everybody. But the bottom line is that there is that point at which a person recognizes, or somebody around the person recognizes, that the individual is in a state of burnout. And there are a lot of conversations, rightfully so, about what burnout looks like and what we can do to heal and move forward beyond the state of burnout. But the other important thing to consider and to discuss is what happens before a person reaches that state of burnout, essentially the road to burnout. The reason why that's so important is because there are many things that are signs, that are red flags, but that may not be seen as big enough, important enough, critical enough to pay attention to. They may be dismissed altogether, they may be minimized, they may be ignored. But if we were to recognize these things, these signs, and pay attention to them and do something about it, about those signs, respond to them appropriately, we may be able to eliminate reaching that state of burnout altogether, or at the very least, if not that, then we may be able to improve how well and how quickly we can heal, we can recover from being in the state of burnout. So let's look at what kinds of things a person may experience that could easily be overlooked or dismissed, but in reality could very well be red flags that burnout is somewhere in the near future. First things first, what does it look like, or what happens when you finally reach that state of burnout? Well, this is a case commonly where people are no longer able to deal with the prolonged stress with which they've been dealing, right? So burnout is the result of dealing with high levels of stress, and once you deplete all of your resources, all of your resilience that you have for dealing with stress, once that is gone, that's when burnout becomes a reality for many people. Oftentimes people realize that they or someone around them is in burnout when they feel like they cannot take it anymore, they cannot give anymore, they cannot do anymore, and they just cannot continue at the same pace. When in the state of burnout, you may reach a new level of cynicism or apathy or a complete lack of motivation. Of course, the worst case scenario is when a person absolutely simply just collapses as a result of burnout. As I already mentioned, burnout will look different for different people. It will look different in terms of how you get there and how burnout looks, how it manifests itself for specific individuals. And a lot of it depends on, well, many things, one of which is your ability to deal with stress in the moment as well as collectively over time. and your resilience. How much do you have in terms of your resources? Because remember, as I already said, once those resources are depleted, and how do they become depleted? By a prolonged period of having to function under high amounts of stress. So once those resources are depleted, that's when burnout can become a reality. But how much you have individually in terms of your resources, your resilience, plays a role in when and how burnout might show up for you. And remember, the things that I will be listing here today, one, by no means are these all-inclusive, but also these are things that may be tempting to ignore or to minimize, to dismiss. But before you do that, before you ignore, minimize, or dismiss them, think that these may just be the red flags that are presenting themselves in front of you for the purpose of informing you that burnout is in your future. So pay attention to these things, don't dismiss them, and give them some time and consideration in terms of, are these things that are new? Are these things that are stacking up? And are these things that could potentially lead to this burnout? It is by recognizing these signs that you can actually be proactive in preventing, prolonging, or dealing better with burnout down the road. When you are heading towards burnout, you may feel resentment. That may be resentment towards your employer, your boss, your colleagues, your customers, your clients, or maybe even resentment towards people outside of the workplace, your friends, your family. Pay attention to that. Is this something new, or is this something that has increased recently? Because resentment can definitely be a red flag of burnout as something that may be to come in your near future. You may not be able to keep up with your workload, whether that's because you have received more work recently than you can handle and you've been trying to keep up with it, or whether your workload is the same but you simply no longer have whatever it took in the past for you to be successful with that. You may also notice a difference in the amount of output that comes from you and the quality of your work. So both the quantity and the quality of your work. You may notice this yourself. Someone else may also notice this and point it out to you. So pay attention to that. You may find yourself feeling unmotivated. You may also feel bored or unchallenged. Often people don't think of that. Oftentimes we think that burnout is much more likely to be associated with an overload of work. But not being challenged at work or not having enough to do may also take its toll. So it's a little bit different for individuals, but pay attention to whether or not maybe you are feeling bored or you are feeling like your work is not really challenging you. You may feel that you get no satisfaction from the work that you do. Maybe there's no meaning that you find in it. There's no purpose for what you do as far as you're concerned. If that's new, that's worth thinking about and talking about. Are you able to concentrate and pay attention like you were in the past? Or are you now unable to have the same level of concentration? Is that something new? Do you find yourself to be daydreaming? Maybe daydreaming about being somewhere else altogether. Maybe daydreaming about having a different job than where you are now. But daydreaming can also be one of those red flags. So pay attention to that. Is daydreaming a new part of your experience at work? Do you find yourself feeling tired more often? Maybe you're having new sleep issues that you haven't had before. Perhaps you are noticing changes in your health. Maybe you are having new health issues. Think about those things. Are they something that is recent in your life or recently increased in your life? all of those can also be red flags when it comes to burnout down the road. You may find yourself taking more sick days, or you may find yourself being tardy more often, or calling in even if you're not sick. So think about that. Is there an increase in tardiness or absenteeism on your part, or someone around you, if you're thinking about someone else as a potential candidate for future burnout in their work experience? What if you find yourself to be more irritable with others? Maybe you're more short-tempered. You may be experiencing new kinds of feelings, emotions, or behaviors that are not really part of your norm, that are not really part of who you are normally. Maybe there are changes in personality or general in the way you behave. Maybe you are now engaging more in significantly more risky behaviors, especially if you're not a risk taker by nature, and all of a sudden you introduce risky behaviors into your life. That could mean anything, from gambling to engaging in illegal activities or promiscuous activities. So think about that. Is that potentially a way of you attempting to deal with this new ongoing high stress level? And in fact, it turns out to be a big red flag for potentially reaching that state of burnout down the road. So pay attention to your behaviors. Pay attention to any risky behaviors that you normally wouldn't engage in. Pay attention to any changes in your moods, in your personality. Some people may start to self-medicate as a result. That's a red flag. And self-medication can come in many forms. It could look like overeating. It could look like drinking too much, maybe drinking more alcohol than you normally would. It could involve drugs, whether that's over-the-counter, prescription, or illegal drugs. So self-medicating comes in many forms. Pay attention to that. Is that a new behavior? Is that something new that you're now seeing in your experience or the experience of someone around you who is a concern to you? So those are definitely red flags for potential burnout down the road. As I already mentioned, this list is by no means all-inclusive. However, it's a good start. It's a good list to get you going, thinking in those terms. Are any of those things or similar things all of a sudden making an appearance in your life, in your experience? Are they new to you? And why are they new to you? Could it be that they are indeed red flags in terms of burnout being in your future? So please pay attention to these. Review the list. Go back and think about other things that could be similar, that could be meaningful, especially to you and your experience. Things that are not part of your normal, not part of who you are, but all of a sudden you are experiencing or engaging in or making changes in your behaviors, decisions, what have you. Because again, it's so easy to dismiss these, but they are very much a potential red flag. When we look at burnout, once you reach burnout, that's a hard place to be. And it takes a long time to heal and recover from burnout. You have to realistically allow yourself the same amount of time that took you to get to that point to heal and recover from burnout. So why not be proactive and be on the lookout for things that may be red flags? And I know that sometimes things are just what they are and they're not these scary red flags, and I get it. That may very well be the case in some situations, but to simply dismiss or minimize what could be a warning sign would be a bad idea. If you have a potential warning sign, why not pay attention to it? why not investigate and make the changes that can help you to prevent burnout altogether or prolong it as long as possible. As this episode comes to an end, let's review what was discussed. Burnout is a big topic of conversation. You already know this. I've done multiple episodes discussing burnout. Oftentimes we talk about what burnout looks like, the symptoms, and how we can heal and recover from it. But oftentimes what is missed or forgotten or not discussed as much are those things that could potentially be red flags warning us about the imminence of burnout down the road. So in this episode, I talked about some of the potential red flags which could be easily ignored, dismissed, or minimized, but really should be taken seriously, should be considered and utilized as a way of making course corrections on your end so that you can eliminate burnout down the road altogether, or at least prolong it for as long as possible. As benign as some of these may look, they really can be definite red flags, especially when they're new to you in the last recent history. Anything from changes in sleep, changes in mood, changes in behavior, to changes in your work quality or quantity, to even how you feel about the work that you do and the meaning of the work that you do. Increased tardiness or absenteeism, or being sick more often, taking more sick days, even taking more vacation days may be a big sign that you need a break from the environment in which you are existing, in which you are trying to survive. Of course, things such as newly developed health issues and behavioral changes such as taking up risky behaviors or self-medicating in a variety of ways could be big red flags when it comes to burnout down the road. Whether you feel overwhelmed with work and feel like you can't keep up, or whether you're simply unmotivated or perhaps even bored or unchallenged, all of those, as different as they all sound, they can all have one thing in common, in that they can all be red flags for burnout. As this week unfolds, I invite you to think in terms of what is on the road to burnout, whether that's for you, and I hope you consider that for you. But also, this is something you can do when you think about a friend or a colleague or a spouse. Burnout is a big deal. It's a serious thing. It takes a while to get into that state, and it takes just as long to heal and recover from it. So why not look for those red flags along the way before you reach the state of burnout, so that you can then utilize these warning signs to make course corrections. So this week, I encourage you to do that. Think about the things I talked about and similar things to see if this is part of your reality. Are any of these new things to you that could be potentially the red flags for the imminence of burnout? And if you identify some of these things, rather than minimizing or dismissing them, think about how you can use them as warnings and as ideas of where you can make changes and corrections to improve the likelihood of you avoiding burnout altogether. For those of you who experience this podcast in an audio-only version, I encourage you to check out my YouTube channel, Stress Free with Dr. G, where you can find the video version of the podcast. In addition to the podcast, my YouTube channel also contains videos that focus on stress management, so I encourage you to check that out. The link for that is in the description below, and that's Stress Free with Dr. G on YouTube. Thank you for joining me today. Please subscribe to this podcast. I look forward to seeing you here again next time. Until then, I wish you joy and well-being.